Good afternoon, everyone. We are C1 Group 2B and we will be demonstrating the physical examination to evaluate a patient with obstructive sleep apnea and recurrent tonsillitis. Obstructive sleep apnea is a sleep-related breathing disorder typically associated with obesity. It is characterized by recurrent episodes of complete or partial obstruction of the upper airway, leading to reduced or absent breathing during sleep. One of the common risk factors for obstructive sleep apnea in children is adenotonsillar hypertrophy. And to evaluate the tonsil size, the Brodsky scale may be used. A grade of 0 is given when the tonsils are entirely within the tonsillar fossa, whereas grades 1 to 4 are given when the tonsil is outside the fossa, depending on how much of the oropharyngeal width is being occupied. Some of the parameters used in the evaluation of patients with obstructive sleep apnea are the Mallampati classification and the Friedman staging system. The Mallampati classification can be used to evaluate patients for risk of obstructive sleep apnea. This classification can be used to describe the degree of airway narrowing.
Good afternoon, I am Rance Lucas, a third-year medical student from UST. Today, I will be performing some PE maneuvers to evaluate obstructive sleep apnea. Can we start?
So to start, explain the procedure and obtain consent from the patient. Then the patient should be seated upright with head in neutral position. Then ask the patient to open their mouth as wide as possible and to protrude their tongue as far as possible. Now using a pen light, check to see if structures such as the uvula, the soft palate, the hard palate, and the pillars can be clearly visualized. A Mallampati score of 1 is given when the soft palate, the uvula, and the pillars are all visible. A score of 2 is given when the soft palate and the uvula are visible. A score of 3 is given when only the soft palate and the base of the uvula are visible. And a grade of 4 is given when only the hard palate is visible. Patients with a Mallampati score of 3 or 4 are at increased risk for obstructive sleep apnea. The Friedman staging system is an anatomic staging system that integrates the Friedman tongue position score, which is an estimate of the degree of obstruction, with tonsil size and BMI in order to predict surgical outcomes in patients with obstructive sleep apnea. To assess for the Friedman tongue position score, so explain the procedure and ask for consent from the patient. Then ask the patient to open their mouth widely. Instruct the patient to breathe normally while leaving the tongue in its normal, natural position. Evaluate the tongue's position relative to the tonsillar pillars, the uvula, and the soft palate. The Friedman tongue position grade is assigned on a scale of 1 to 4, with grade 2 being split into grade 2A and grade 2B. Friedman tongue position grade 1 allows the observer to visualize the entire uvula and tonsils or pillars. Grade 2A allows visualization of the uvula, but the tonsils are only partially seen. Grade 2B allows visualization of the complete soft palate down to the base of the uvula, but the uvula and the tonsils are not seen. Grade 3 allows visualization of some of the soft palate, but the distal soft palate is eclipsed. And grade 4 allows visualization of the hard palate only. The next component of the staging system is the tonsil size. To assess the tonsil size, ask the patient to open their mouth. Depress the tongue using a tongue blade. Using a pen light, inspect the back of the patient's throat and look for the tonsils. The tonsil size is graded from 0 to 4, wherein grade 0 would mean the absence of tonsillar tissue, grade 1 represents tonsils within the pillars, grade 2 represents tonsils extending to the pillars, grade 3 are tonsils extending beyond the pillars but not to the midline, and grade 4 represents tonsils that extend to the midline. Tonsilitis is the inflammation of the tonsils. To evaluate a patient with recurrent tonsillitis, we have to inspect the patient's tonsils.
Good afternoon, I am Rance Lucas, a third-year medical student from UST. Today, I will be doing some PE maneuvers to evaluate your tonsils. Can we start?
Explain the procedure to the patient and obtain consent. To assess the tonsils, ask the patient to open their mouth, depress the tongue using a tongue blade. With the help of a pen light, inspect the back of the patient's throat and look for the tonsils. Observe for any abnormal changes such as erythema, edema, enlargement, or any exudates. This is the Paradise criteria, and this criteria is used in assessing and diagnosing recurrent tonsillitis or throat infections in order to determine if the patient is a candidate for tonsillectomy. This is the end of our presentation. Thank you for your attention.